Did you know that you can lower your own blood pressure? I'm Dr. Melinda Steele, a double board certified physician, and I give people the chance to improve their own health. Let's talk about high blood pressure. Nearly half of adults in the US have it, and a lot of us don't even know it because usually people feel totally fine. The issue is elevated pressure damages our organs and sets us up for things like heart attack and stroke and kidney failure, which usually creep up silently until there's a big problem. But here's the great news. You have the power to lower your own blood pressure, and small changes can lead to big results. Just for example, if you decrease your blood pressure by 10 points systolic, which is the top number, it can decrease your risk of heart disease by 20% and decrease your risk of stroke by about 30%. So if you want to lower your blood pressure, here's a good place to start. Salt, sodium chloride. The average American eats 3,400 milligrams of sodium per day. The American Heart Association recommends ideally no more than 1,500 milligrams per day. I personally shoot for about 1,200 or less for optimal benefit. I've had many patients with high blood pressure say, I don't salt my food, so I don't eat much sodium. False. 70% of the salt that we eat is not coming from the salt shaker. It's coming from processed foods and restaurant foods. So if these are regulars in your diet, they've got to go. So get this, if you have high blood pressure and you decrease your sodium intake to less than 1,500 milligrams a day, you can decrease your systolic blood pressure by up to 15 points. This would decrease your risk of stroke by 30%. And bigger picture, it would save 40,000 people from dying of stroke in the US per year. So go ahead and read that label and pay attention to how much sodium is actually in your diet. Want to learn more ways to improve your own health? Follow me.